here to talk about a new frontier. What if we could use the power of this new information age to prevent and stop outbreaks in their tracks? I'm going to show you how big data and analytics are opening up opportunities for us to do just that. But first, I want to take us back a few years to West Africa. This is Etienne Wamuno. He lives in a remote village in Guinea, a few miles from the Sierra Leone and Liberia borders. And in late 2013, his 2-year-old son, Emile, became sick with fever, vomiting, and bloody diarrhea. Etienne sought help for Emile, but within a few days, actually just a few days after Christmas, his son died, followed by his daughter, Philomene, and his pregnant wife, and his mother-in-law. The midwife that delivered his stillborn child also died, but not before she traveled to another village. Quietly, the virus spread from one community to the next, undetected for months. By the time officials determined that it was Ebola, 3 months later, the virus had already spread to 3 West African countries. Health officials were left scrambling to respond to an outbreak already spiraling out of control. Officials like Luke Bawo. Luke led Ebola surveillance in Liberia. He knew he needed the right information to stop Ebola. But getting timely, accurate health data was a daily struggle. Reports came in any way possible, by phone, by text, by email. Luke was in the center of an exploding crisis with data that could not give him a clear view of what was happening. Surveillance systems were siloed and unconnected, making it really hard to track an individual patient from the clinic to their labs results to their contacts in communities. The system was simply unprepared for an outbreak of this magnitude. For highly capable health officials like Luke, it was like trying to respond to an epidemic while blindfolded. Luke can't stop what he can't see. In this globally connected world with changes in trade and travel and climate and land use, outbreaks like this one can't be ignored. Disease knows no borders, and the threat is only increasing. Outbreaks of all kinds have tripled over the last 40 years. SARS, MERS, Ebola, Zika. This is our new normal. And all experts say that a global influenza pandemic is not a matter of if, but when. And the impact can be catastrophic. The Institute for Disease Modeling in Seattle has estimated that a global influenza pandemic, similar to the 1918 flu, could kill 33 million people in just 6 months. 33 million. And the World Bank estimates that the impact on the global economy would be $3 trillion. In fact, Bill Gates believes that a global influenza pandemic is one of the greatest threats to humanity. When it comes to infectious disease outbreaks, whether pandemic flu or Ebola or even malaria, we can't stop what we can't see. But right now, data are simply not effectively collected, analyzed, or deployed to drive decisions to stop outbreaks in their tracks. But the good news is that we are in the middle of an information revolution where big data and artificial intelligence are helping us make more informed decisions every day. Whether finding the fastest routes to work or recommending what movies we should watch next. And with growing confidence in forecasts, we believe the information when it matters most. With better data and modeling, we can give responders like Luke improved line of sight when it matters most to them. In fact, we can now reimagine the epidemic intelligence systems of the future, shifting from reaction to prevention and precision response. With better data for decision-making, we can detect outbreaks rapidly, respond with precision to stamp them out quickly, and even begin to predict outbreaks before they occur. We can't stop what we can't see. Information is our best countermeasure. And in fact, it should be our superpower against disease. When I was at USAID leading efforts to source innovation to combat both Ebola and Zika, I saw a lot of really promising ideas. Big data are already being used to detect outbreaks faster. By scouring news sites across the internet from Google to Baidu, HealthMap is detecting outbreaks across the world. They even alerted the world to the 2014 Ebola outbreak before the WHO. And that same team has used signals from both Twitter data and Google search data to track the Zika epidemic. But we're also, with advances in digital technology, getting new data streams, like these smart thermometers connected to a cloud that alert communities to a spike in fever the minute a mother or a school nurse takes a child's temperature. These real-time data can give us a head start on reports of disease coming in from doctors. Critical time to speed a response. We can't stop what we can't see. Information is our best countermeasure. Now, we're also beginning to hone the tools to respond when an outbreak does happen so we can stamp it out quickly. Responders like Luke need to know, if they're faced with an outbreak, how quickly a disease is spreading, where it's going next, how big that outbreak may get, and what are the most effective actions he can take to stop it. New tools are giving him the line of sight he needs. Using advances in next-gen sequencing, scientists can now look at the genetic data from viruses to track how a disease is spreading, giving Luke important information on disease transmission. And using anonymous aggregated data from cell phones, we can now track population movements so we can forecast where an outbreak may spread next, giving Luke and communities time to prepare. And with better data and modeling, we can now assess which interventions are going to be most effective at stopping an outbreak, whether safe burials or border screening, or even deciding who should be vaccinated first. But our vision of what's possible doesn't need to stop there. Exciting advances are emerging with predictive analytics. This is where AI comes in. If we layer multiple streams of data together and we use the power of machine learning, we are beginning to be able to predict outbreaks before they occur. There are a few early examples of this. 2 years ago, Yemen experienced the world's worst cholera outbreak on record, with more than 1 million cases. 2,000 people died. Most of them were children. So last year, in a race against the rainy season, a multidisciplinary team led by the University of Maryland was called in to try something new. They developed detailed risk maps, layering data from NASA satellites with data on temperature and rainfall and access to clean water. And they were able to pinpoint which neighborhoods were most likely to experience an outbreak up to 4 weeks in advance. Just as meteorologists can warn of a severe storm on its way, this team alerted health officials to cholera that might be on its way. Communities had warning, and responders knew where to target limited resources. And early data showed that this dramatically reduced the number of deaths. And responders have said if they could have an 8-week warning, they would have time to deploy a vaccine to keep people from getting sick in the first place. Information is our best countermeasure. Now, experts can and they will debate just how far we can take predictive analytics over the next decade. And make no mistake, it will be hard. But where it works, the impact can be extraordinary. These examples show the potential power of outbreak analytics. But solutions are still siloed and progress is too slow. And very few of them are actually integrated into tools that responders like Luke have at their fingertips. There are 4 barriers holding back progress. Data quality and access is a huge challenge. In fact, in a lot of resource-poor countries, our patient data is still collected by pen and paper. And the transaction costs for sharing data are high, both for those that have and those that need the data. In fact, it can take one researcher up to 9 months to develop a data sharing agreement with just one mobile operator. But there are hundreds of mobile operators across the world, and if that agreement's not in place in a country experiencing an outbreak, it's incredibly hard to mobilize these data quickly. But even if we get access to data, our outbreak analytics capabilities are still in their infancy. In fact, our disease forecasting capabilities are back where we were in the 1970s for weather forecasting. And then it does no good to have all these insights if they're not used for better decision-making. We need to ensure that those in a position to act, whether global officials to national responders like Luke to healthcare workers on the front lines, that they have the capacity and training to manage these data and put these enhanced insights to use. And then finally, all of this work is fueled by funding. But our funding is fragmented and not aligned around common priorities and opportunities. And in fact, it suffers from the same repeated panic and neglect cycle where we invest generously during a crisis and we turn our backs as soon as that crisis is over. So, how do we get past these barriers? I believe we need a new way of working. So last summer, I brought together experts across sector with the support of the Rockefeller Foundation to reimagine how we could leverage this new information age to step up progress over the next decade. Together, we created a new solution. We call it Platform I. Platform I is a global collaborative to transform our epidemic intelligence systems. We need to bring together the best minds in industry, in academia, and public health to build on what works now and exponentially accelerate progress. And we need to catalyze new funding. By pooling funding, we'll be able to enable donors to align their investments and share risk so we can drive forward greater health impact. So here's how it'll work. To open up access to data, we will build a trusted network of partners, of data owners and data users, creating standards and models and incentives for data sharing, making it easier to access data while, importantly, protecting privacy and keeping data secure. And to ensure we can derive greater insights from those data, we will accelerate the analytics by building cross-sector data collaboratives around priority problems, and we will foster rapid experimentation on how we use and combine different types of data to extract more meaningful insights, just like they did in Yemen. And then, to ensure that we can put those enhanced insights to use, we will invest in the most promising solutions, data collection tools, and open platforms that leverage these cutting-edge analytics, and will ensure that they're all designed and developed to be used by those in a position to act. We can't stop what we can't see. It's time to move our outbreak analytics into the 21st century. Weather forecasting has been around for hundreds of years, but our ability to forecast with accuracy only took off in recent decades when the global community committed to investing in better data and better models. We need a similar commitment to outbreak analytics. If we unlock the predictive power of data, identifying risks and outbreaks faster, we can shift the paradigm from reaction to prevention and precision response. But we need imagination and aligned action. Now is the time to come together to work toward this bold vision. WHO's Director General has called for 2019 to be the year of outbreak analytics. You too can join this movement at platformi.io. Right now, Congo is battling the world's second largest Ebola outbreak in history. So as we, yet again, watch another Ebola outbreak spiral out of control, we are reminded again just how much is at stake. Together, let's remove the blindfold so responders like Luke can use the power of information to see what's in front of them and on the horizon to best protect their communities. Let's use the power of information to protect us all. Thank you.